Hello, my name is Dr. Julie Orlowski, and I'm one of the family physicians with Cornerstone Care. I wanted to take a moment today to talk with you about one of my favorite subjects, the heart. In February, we celebrate American Heart Month. This is a very important topic for us to discuss because heart disease is the #1 cause of death in America, and that's among both men and women. Another important reason to discuss this is that many of the risk factors for heart disease are preventable. So I'd like to go through each of these 8 risk factors with you and give you some tips to help protect you. The first risk factor is high blood pressure. High blood pressure is very frustrating for many patients because you typically have no symptoms. So you may have high blood pressure and you may never know it until you come to your family doctor and we can check it here. There are many simple things if you do have high blood pressure that you can change in your diet and your lifestyle to help lower it. Cutting back on salt, caffeine, quitting smoking, making sure that you're getting aerobic activity every day, just those little changes can make a big difference. Just like with high blood pressure, this is very frustrating for patients because you may have high cholesterol, but you may never know it. And so that is something that we typically as family doctors check about once a year on blood work. We get a full lipid panel, and that can tell us if you do have high blood pressure, and simple things can also help with that. Cutting back on fried foods, processed meats, just picking a leaner cut of beef can make a big difference in the lipid profile. Sometimes medications are necessary, and we'll know if we need to take that next step, but the most important thing is finding out where your cholesterol is. The next risk factor is diabetes and also prediabetes. And again, this is something when you come into your family doctor for your yearly visit, we can check those numbers. Prediabetes is a warning that you could be on your way to developing type 2 diabetes, which is a completely reversible disease with simple dietary changes. And so if we find prediabetes early and we have that warning sign that you may be on your way to developing diabetes, we make the changes early, and again, we protect your heart. I think everyone in America knows that smoking is not healthy for us. Now, many years ago when I started practice, we didn't have the medications to help patients now to quit smoking. And if we did have them, they were very pricey and very difficult to get at the pharmacy. But now we have many options that we can help you, not just through medications, but through talking to you about different tips and tricks to get rid of the cigarettes, because that will be the greatest gift you could ever give yourself and your heart. The next risk factor is being overweight or obese. The CDC finds that the prevalence of obesity in America at this time is 41.9%, which is far too high. As a family doctor, I encourage my patients to come and talk with me so that we can help you in a way that will benefit you for the rest of your life. For instance, I have many patients keep food diaries. They can come in about every month and we review their food choices. For other patients, we talk about some of the different diets that are out there, different lifestyle changes. It has to be something that will work for you and will be sustainable. We also can talk about things like intermittent fasting, which offers caloric restriction for patients that can aid them in losing weight as well. The next risk factor is having a sedentary lifestyle, not being physically active. You know, nowadays we all have smartphones, so we need to start tracking our steps and aiming for that 10,000 step goal, and maybe we're only at 4,000 steps, but if we can get that up to 5,000, that has made a difference. They also, on these apps, they can alert you that you haven't moved enough that hour, so it's time to get up and start moving. So as I talked about and alluded to earlier, just simple little changes, coming to your family doctor, sitting down, going through that food journal. For the high blood pressure, cutting back on the salt. If the cholesterol is high, making those changes that we talked about with picking leaner cuts of meat, avoiding the fried foods, all of those little changes to improve your diet and finding something that works for you. You know, there's no bad diet. It's just the diet that you can stick with is going to be the one that's going to work best for you. The last risk factor is one that we have completely no control over, and that is our family history. So if you've had a mom, a dad, a brother, or a sister that has had heart disease, that is key to us, that we need to be very aggressive. We need to be checking blood work every year. We need to be making sure your blood pressure is in a good range, helping you quit smoking, working on all the preventable risk factors to protect you when we can't change your family history. Thank you so much for allowing me to go through these risk factors with you and give you some simple tips and tricks that you can do at home every day of your life to protect you from heart disease. I thank you for your time. For any more information on this, the American Heart Association has an excellent website. It is www.heart.org. And also, we look forward to seeing you. You know, it's February, it's winter time. We would love to have you. There's not much else to do. We'd love to have you stop in, see your family doctor, and allow us to help you.